our homeopathic practice, you know, from your practical experience, we have a good number of homeopathic doctors. We have also good number of students. See, when you look at the homeopathic practice, you know from your clinical experience that many times a deep acting remedy, for example, sulfur, for example, netramure, for example, calcarea, though they are very deep acting remedies, we indicate based on a certain totality, we also indicate them for acute complaints. So what I was trying to emphasize here is a homeopathic remedy will have an acute picture, and a homeopathic remedy will also have a chronic picture. Okay. Now, in today's class, as the topic has already been circulated, we'll be discussing Ignitia, the acute picture of Ignitia. Ignitia also has a chronic picture. We will not look at the chronic side of Ignitia. Next 1 hour, we'll be trying to focus mainly on the acute picture of Ignitia. Now, as the topic, I have rightly told you, clinical glimpses of Ignitia and acute picture is what we'll be discussing in detail. Now, what do you expect from me? Or, what have I planned for you for next 1 hour is what I'm trying to share with you. This is what I've planned for you. Please keep all your in the mute mode, microphones in the mute mode, so that we don't have any disturbance, and there will be clarity in what I'm trying to explain or in what I'm trying to share. So what I was trying to tell you is, I'll be trying to describe the acute picture of Ignitia, and we'll also try to compare and contrast related remedies. And in the last part, or what I'll also try to do is, we'll also try to bring in some cases so that this session is more practical. Hope I'll be in a position to do justice. Now, before we start with today's presentation, we'd like to take blessings of Dr. Hanuman, the founder. Probably without him, we wouldn't have been connected online or offline. So, seeking blessings from Dr. Hanuman. See, I've always been trying to tell, though it was Dr. Hanuman who invented homeopathy, I did not understand homeopathy the way I have understood after meeting this great man, my guru, my teacher, Professor Vijaykrishna sir, and he's a well-known personality. Okay, so I mean, I've been also insisting that we can speak a full-day webinar on him. So thank you so much, sir. We have gained a lot of knowledge, and you still continue imparting the knowledge. Thanks for your the knowledge and the guidance, the blessings that you have been giving to all of us. And one more person I would like to thank is my teacher, who's had a beautiful is an acute case. The complaint started a day before. Okay, so I have taken this aphorism, the fifth aphorism, and it says the exciting cause. Yes, many of you are rightly coming out with the interpretation. Now, what happened? Why did this child develop fever? Is the question that becomes very important. Now, this is what many of you ask in your clinics. I ask the same question: what happened and why did the child develop fever? That was the question. See, now the history goes like this. Mother was watching TV and she was engrossed watching TV. She was watching her favorite, something she was watching on TV. This child went to the mother and she wanted to kiss the mother. The mother, who was so much involved in the serial, in the TV, pushed this child aside. This is what the mother did. And then this child went into the room. And after mother watches her TV serial, she'll get back to the child, and she is shocked to see that this child has got high fever. I hope I am clear. Now, what can be thought of in this particular case? As I told you, it's a very simple case, easy to solve. So she felt ignored, but unfortunately, we don't have a rubric. Ailments from being ignored. Very good. She felt ignored. Good. Beautiful. What else? What else can you think of? She felt neglected. Yes. Beautiful. She felt rejected. Yes. See, now what is the small mistake that we are doing here is we are putting ourselves in the patient's shoe and we are giving answers. Now, what would have been a nice way? Sir, what did the patient feel? You're getting my point. This is what we are all feeling. But what did the patient exactly feel? So the question that was asked, yeah, see, the reactions could be plenty. Now, see, now you have given me a lot of reactions. Yes, somebody said anger, somebody said disappointment. Expecting this, I have got you a small scenario here. I, being a teacher, I have got you a small clip where the teacher is scolding the child. Now, do you think all students who have been scolded by the teacher will have the same reaction? Yes. Now the reaction could vary according to the individual. Okay. So this is very, very important, as Dr. Arsha was trying to tell, that there are a lot of students who are part of this particular thing. So what you need to understand here is the individualistic approach that becomes very, very important. So what you need to understand here is when somebody scolds, I've just given an example, what could be the probable reactions anybody can come up with? Can somebody quickly tell? See, the interaction will be fun if you're quick, okay? Otherwise, we'll be wasting a lot of time. Yeah, beautiful, very good. I mean, I'm happy with your speed. Beautiful, good. Yes, yes, very good. Yes, a lot of things. I don't know who has told what. I'll not look into the chat box. Yes. See, for example, if again you have a pattern here, don't jump into the answers. Now, what is the thought process? For example, if a child is a very sensitive child, the child might feel offended. Okay, the child might feel ridiculed. The child might feel insulted. The child might feel criticized. Yes, very good. The answers that you are giving are absolutely fine. I'm happy with what you are answering. For example, if there can be anger, an emotion which can be a reaction to the scolding. Anger, or another thing, that is the child can start arguing with the teacher. I did not do any mistake. Why are you scolding me? When, for example, you have somebody like Merck, somebody like Naxwamika, they can argue like that. Fine? Or they can become malicious. That they want to do something to the teacher. Right? Or they will not forget the hurt the teacher has caused. So they can become malicious, or they can develop a hatred towards the teacher, right? Or as many of you have tried to tell me, they can go into a revengeful mode. Oh, that day you did this to me. Oh, I will not spare you. They can go into a revengeful mode. Or somebody rightly said they can go into indifference. Yes, they'll not care. Or now something very important here is there is no sensitivity at all. Fine. The child can become shameless. This is what you will do to me. Fine. Okay, fine. You want me to stand up on the bench? I don't mind. I'll stand up. He can become shameless. There might be want of sensitivity. Any of these reactions and the reactions that you have given to me can also be added here. Now, this is only a small example. Now, a simple scolding. Each student, each constitution reacts in a different way. Now, if you understand this, then a part of homeopathy becomes very, very easy for you. The prejudice thing will get eliminated from our mind. Each individual is different. So the reactions also will be different. This is what I want to make very, very clear to you. Okay. So now when I inquired with this child, I know this child, she is an old patient of mine. So when I inquired this child, like what exactly happened? What did you feel? Sir, uncle, I felt hurt. Okay. So simple. I have taken two very important rubrics. I have given you the rubrics here. One rubric that you see here is ailments from being offended. And see the speed at which the child develops fever. Mother was watching TV. She saw TV for some time and then she will go back to the child and then you have a child developing fever. Okay. 3 remedies you have. If you just look into the repertorial chart and people who can't see it properly, you have Acute, you have Ignitia and you have Clonine. Now, which remedy you want to prescribe? 3 remedies, very simple. 3 remedies. Very good. Now, today's session is on Ignitia. So, all smart doctors, they're under Ignitia. Okay. Now, why it can't be Acute? Why can't it be Acute? Fine. Now, you see the sudden manifestations. You see Acute also standing there. How do you differentiate Acute from Ignitia? That is very important. Now, as Vijaykrishna says, majority of the things they are given in our organon. So I'll just bring a footnote to your notice. Now, when this child, I have the videos, but unfortunately, due to some technical reasons, I am not playing the videos. And all the assistants of mine who are attending today, they have seen this case. Now, if it was Acute, see the beauty. Please try to understand this. Layer by layer, you try to understand this. For example, if this was Acute, how would Acute behave? This is very, very important. Now, Dr. Hanuman, in footnote number 122, he says, Acute cannot be prescribed in a patient who is very quiet, who is very calm, and who is very, very silent. Fine? Okay. Now, this child, whom I had treated her for adenoids constitutionally way back with Hyoscyamus, very restless child. She would jump, she would climb, all the stuff. Very restless child. Today, with fever, she is very dull. You're getting my point? So, Acute gets ruled out. Fine. So that calmness, whatever it is, that dull, chilly, thirstless. I follow Vijaykrishna's acute theory, that chart. So that also was taken into consideration. These 2 things, and the remedy given to her was Ignitia. Okay, Ignitia 1 ml, 1 dose, and they follow up. The child feels better. See, when you give the right homeopathic remedy, beautiful things happen. You don't worry. I mean, the child felt better. I will again talk of a small case, and then we'll continue with Ignitia. See, if at all you have any doubts, we have a separate section, in the end. I'll not take up doubts in between. It will break the continuity. So we'll definitely take up the questions, concentrate on the presentation, make a note, and anything that you feel you have to ask, you can always get back to me. Now, this is a second case. Remember the first case, we are talking about a second case. Now, what is this second case? A child aged around 6 years. She complained of joint pains and she had fever since 4 a.m. Now I am directly giving you the ailments here so that we'll not waste much time. Now, this particular child, she was doing some mischief, meaning she was taking a paper and she was cutting it. She was cutting the measuring tape and all those things. Some mischief she was doing. And what the mother did was, the mother hit the child because the child was doing mischief. In sleep, that same day, night, in sleep, she was murmuring that my mother hit me, and around 4 a.m. or 5 a.m., the child was very restless. So they examined, and they found the temperature was very high. So that early morning, they have given paracetamol, and next day this child was brought to my clinic, and child had high fever, and child was looking very dull, and she was not able to open her eyes, and she didn't want her to look at light. Now, quickly, we'll take a few seconds break here so that you can interpret what exactly I want to tell here, or what exactly you want to contribute here. Now, how do you solve this simple case? How do you solve this simple case? What are your inputs? Very good. Somebody says, okay, network is very, very poor, not able to understand anything. See, for example, if you're not able to understand anything, don't worry. We'll upload it on our YouTube channel. You can watch it on YouTube. That's not an issue. But for time being, see, there are a few things. Many of the young doctors and few of them have seen this case live, and they have got the answer also right. Yes, beautiful. Now, the inputs that we are getting here is, now there are inputs which says ailments from punishment. Now, how do you differentiate this from ailments from reprimand? Very good. Dr. Archana has told ailments from reprimand. How do you differentiate ailments from reprimand and ailments from punishment? Which rubric is apt in this particular case? Is it ailments from reprimand, or is it ailments from punishment? See, now reprimand means what? Reprimand is scolding, and punishment is you literally or physically punish the child. So here the child was hit. Okay, here the child was hit. The child was not scolded. No, don't cut, don't do that. The mother did not tell that. If the mother had told that, then it would have become ailments from reprimand. Now here the mother hit the child. Okay, so from what you have given me, from your inputs, I have taken two rubrics, and please have a look at the rubrics. Ailments from punishment was one rubric, and photophobia, fever during, was the other rubric taken. And look at the surprise remedy that comes up. Look at the surprise remedy that comes up. The remedy is conium. I felt very happy. I felt very happy. So I looked at my, the young interns who are assisting me, and with a lot of pride, I took ailments from punishment and fever during photophobia, and I prescribed conium. Trust me, for first time in my life, I prescribed conium for acutes for fever. So I was a little excited. I was waiting for the phone call. 11:30, the mother calls, and when she had come to the clinic around 8:30, the fever was 101. 11:30, the mother calls and she says, "Sir, fever is 103.8. High fever." Fine. So don't tell me it is homeopathic aggravation. Okay. The child, the generals were very bad. She had not even taken a drop of water. Done. And it was bad. The child was drowsy. So paracetamol was given. Instead of giving paracetamol, fever did not come down below 101. Then ibugesic was given. Ibugesic was given. Again, whatever you give, it did not reduce below 101. So conium 1 dose was given. This is what I told. Fever went up. And next day she came to my wife. Child was very dull. Next day morning she came to my wife, who is also a homeopath. So she took a totality. She saw the child had high fever. Head was very hot to touch. Extremities were cold. And you all know a simple remedy, belladonna was given. And unfortunately, belladonna also did not do any good. Okay. Now, patients started panicking, meaning patients, parents, they started panicking. You have COVID, and the entire family of theirs, we had treated them for chikungunya. So they were worried if our child also developed chikungunya, what is happening? They were in a very bad turmoil. So I was also losing this case somewhere. Okay. Now evening they brought back, again they brought back, and fever did not reduce in spite of IPGC. This is when the parents were worried. Okay. Now, see, in acutes, we change medicines very often. Okay. We expect, you have seen a lecture on acutes, which I presented 2 days back. We expect very dramatic, fast relief in acutes. You can't take time, you can't buy time. Okay. So we were not happy with the improvement. Again, we saw what is the picture that is coming up. Please remember, in acutes, a new picture might come up, and take that new picture and start prescribing. So what we did was, we retained the ailments from, because that's how it started. Aphorism number 5, ailments from punishment was retained. And one thing that the mother started noticing was, the mother told that, she wanted her, the mother, like she wanted her to be with her and she needs to be pressed. Now, tomorrow, if you get a situation like this, where the patient wants somebody to press, wants somebody near to them, and they want to press, no, then the rubric will be magnetism or mesmerism amelioration. I have used this in many cases. I'll share you one more case here. Now, here, 2 rubrics were taken, and if you again see, conium is coming up. Okay. But having given conium and absolutely no relief, I didn't think of repeating conium. So we changed the plan. Child was dull, child was chilly, child was thirstless. So what was done was Ignitia 1M was prescribed. See, now these cases, they look very simple, but many of the practitioners, sitting on that hot chair, they're very difficult to treat. So Ignitia 1M was prescribed. Temperature came down to 101, not reducing further. But this time they did not give paracetamol, mind you. Last time with ibuprofenic, the temperature came to 101 and it did not reduce further. Patients again, they were very anxious and they told, sir, we will consult a pediatrician. I said, fine, because I was not in a position to help them. I said, fine. But then they did a WhatsApp consultation, and then again they came back with all those antibiotics, paracetamol, and he had given the suppositories and all those things. And again, having known the parents, I took some more time and I told, we'll wait till morning. Anyway, you have your antibiotics, anyway, you have your antipyretics, etc., etc. At least you will be a little confident and safe. Give me 6 more hours. I begged and purchased the time, meaning I took some time. Now, Ignitia 1M did some trick. Okay. Now, what I did here is I gave her Ignitia 10M. Fine. And child generals improved, appetite improved, there was no fever, and child became normal. This is a case which many of the assistants who are part of today's webinar, they have seen. Now, what I want to try to tell you here is, in acutes, what I've observed of late is high potency, like 10M. They're giving me good results. So it's worth sharing. Okay. Now, one more case I'll discuss and then we'll get back to Ignitia. See, please remember these cases. Case 1, where we had given Ignitia, ailments from being offended. And case 2, we took ailments from being punished. And case 3, this is an young man. We spoke of kids. We'll change to one young man. He is 36 years old and he again presents to us with fever. So, aphorism number 5, especially when you're treating acutes, it becomes very, very important. Make sure you ask why, and you'll definitely get the reason for that why. So, see, because of lockdown, his parents, they stay in a different place and he stays in Bangalore and he frequently visits them. And unfortunately, because of the lockdown, he could not visit his parents. And there was a small ceremony and, many of his cousin brothers, they were all planning to come. Somebody has not muted the thing, Now kindly mute so that we get a better clarity of voice. Okay. So I'll get back to this particular case. Now he was eager to meet his parents, but wife also told, now because of the COVID situation, we have a child also at home. You please don't go. Fine. Now what happened here is after that he starts developing fever. Very very rarely we get adults reacting like this. Again, when I asked him, what did you feel? What did you feel? See, he felt disappointed. I'm giving you the rubric straight because there are a lot of things to discuss and we should not miss on the other things that I planned for you today. So here, this patient felt disappointed and I told you I use the rubric magnetize or mesmerism in acutes when it is there. Now this man again, he wanted his wife to sit next to him and keep rubbing over his back and he would feel nice, he would feel better. Now this is magnetism desires for. Again here, this patient was prescribed Ignitia and he improved very well. Now, if you look at those three cases that I have tried to tell you, you see something very common in all the three cases. Now, what is it that is common in all the three cases? That all the three patients that I have discussed with you are patients who are, can somebody tell me what is common in all the three cases that we have discussed? In all the three cases, yes? Yeah, very good. Dr. Samta, if I'm right, if I got it right. Very good, absolutely right. See, all these people that we have discussed, they're all very sensitive people. Very good, absolutely right. Yeah, if you answer correctly, then, or if you interact, it will also be very encouraging for the speaker. Otherwise, this being an online class, we don't know how things are going about. So what I was trying to tell you here is, one very important aspect of Ignatia's acute presentation or acute picture is they are very, very sensitive. They're very refined, they're very sensitive. Fine, they're very delicate, very gentle. Fine. Now, what exactly Ignitia is sensitive to? Now, that's what I'm trying to tell you in the next class. I mean, in the next slide. Now, Ignitias are very sensitive people. Fine. And look at the images that I've also tried to show you here. They get offended very easily. They get offended very fast. So sensitive, they get offended very easily. In this image, you see people quarreling, meaning parents quarreling. They're sensitive to quarrel. Very good, absolutely right. They're sensitive to quarrel. See now, if you dig deep inside the Ignitia psyche, why are they sensitive? What brings on sensitivity in Ignitia? Now, Ignitia deep inside are very insecure remedies. Insecure remedy. It's a very insecure individual. They always have a fear of being rejected. Okay, so this fear of being rejected brings on a good amount of sensitivity in Ignitia. They're sensitive to scolding. You see this picture. They're sensitive to admonition. Now, what is admonition? Even anything you tell in a very nice way, in a very gentle way, because of they having this quality of being offended easily, they take it in a very negative way. Okay? So sensitive advice, sensitive things, they can't take it. Very insecure remedy. That's what I was trying to tell you. Now, because of all these things, because of the insecurity, because of fear that they will be rejected, Ignitia will study well, will try to be in good books of the parents. You should have come across this good girl image. We have Staphysagria, we have carcinosin, we have lycopodium, we have few remedies. Now, Ignitia is one remedy. They will do their homeworks regularly. They would like to go to school regularly. In school also, they are very well behaved. Even when they come to our clinics now, the way they behave, the way they sit very erect. Fine. All these observations, you see it in Ignitia. Now, why they do all this is because deep inside they feel, if I don't study well, My parents may not love me. My parents may not hug me. My parents may not give affection towards me. Now, this is the thought process deep inside you have an Ignitia. Now, this aspect of Ignitia is very important for you to differentiate Ignitia from other remedies. Okay, when we talk of comparison a little later, you'll understand that Ignitia has this particular thing which you'll have to keep it in your mind. Okay, so there are a few waiting in the lobby. If the host can permit them to enter, they can also join and listen to the webinar. So I hope this part is clear to you. Now, what is this slide that I was trying to explain it to you is that, the sensitive part of Ignitia, which is very, very important. Okay. Fine. Okay. Now we look at the other thing. Now, apart from the sensitivity, when you look at the other, one second, what is this? Yeah, it's clear now. See, now if you look at the other aspect of Ignitia, Catherine Coulter, the author, calls Ignitia as a funeral remedy. You see a good amount of grief. Okay. See, naturally, Ignitia is a very sensitive constitution, very emotional constitution, very emotionally attached constitution. So what you see is somebody dying, somebody close person dying will bring a huge impact, a huge emotional turmoil will happen in Ignitia. So we'll just look at this aspect of Ignitia, that what does bereavement, what does death in Ignitia cause? Okay, what exactly or how exactly they react when somebody dies. Now, the bereavement or death of loved ones or death of a child or death of parents, these are all three things that affects Ignitia very badly. And this in Ignitia, you have to remember how I told you, each individual may react in a different way. Today's focus is on Ignitia. We'll try to understand how Ignitia will react when there is bereavement. Ignitia will start going into a grief. We'll discuss this. They start going into grief and they might start weeping. Again, grief, each remedy, how they react, how they express grief is different. Under comparison, I'll try to take up this. Now, how each remedy weep is also very, very important. I have a beautiful case which I'll be taking after this. Now, each individual, how they weep or how they express the grief also becomes important. Now, in Ignitia, the bereavement or the death, the grief can give rise to insanity. And as you all know, in Ignitia, they can also go into hysteria. This is very, very important. Okay? Because of death, because of losing a close person, they can go into a highly syphilitic reaction. See, these two are syphilitic reactions. Insanity is syphilitic, hysteria is syphilitic, grief is psychotic, and weeping depends. How you weep, all those things, based on that, we can arrive at the miasm. I hope this slide is very clear. We spoke of the sensitivity, and we're looking at the second aspect, that is the bereavement part. Okay. Now we'll understand this theory part with a case, so that this information remains in your mind for a longer period. 21st July 2020, we had a case. I had to take this case over the phone because of the COVID situation. And this lady, aged lady, 60 plus years old lady, she's been suffering with acidity for last 2 years, and she's feeling anxious. There is increased palpitations, anxiety in the chest, and small things she's becoming very, very anxious. She consulted a doctor. He gave allopathic medicines. Since then, she has acidity. A pet, she had a dog, 12 years old. The dog expired 3 days back, and she was very much attached to this particular dog, and she felt very bad. Okay. Now, this is the small case. What could be the probable rubrics that you can think of in this case? Okay. What could be the probable rubrics you can think of? So it's a very short case, small case. What could be the probable things? Very good. Yes, we have nice inputs coming up. Beautiful. Okay. Ailments from death. Okay. Yeah. Now somebody rightly says, what was the reaction? How did she react? What did she feel? Very good. Good. Now we are coming to the right track. Now, when we inquired her, it's a nice question. What did you feel? How did you feel about the entire thing happening? Okay. Now, based on that, the following rubrics were taken. Okay. Now, ailments from death of a child. That dog, that pet, she almost had considered her to be a child. Okay, so that was taken into consideration. And after taking some allopathic medicines, now she developed some issues. So even that, you have it under generalities, medicaments, allopathic medicine sensitive to. That was taken. And small things, she would become very anxious. And the anxiety, where exactly she is feeling the anxiety, that is also very important. This lady would feel anxiety more in the chest. These four rubrics were taken into consideration and see the remedies that will come up. Ignitia, Naxwamica, sulfur, calcarea. Now, the beauty of repertorization, it will definitely reduce the number of remedies. But again, we have to use our materia medica and only then we have to differentiate from the final analysis. Now what we got four remedies and Ignitia, Nux, sulfur, calcarea. Okay, she was chilly, so sulfur, straight away I rule out. Then I'm left with Naxwamica, I'm left with calcarea, I'm left with Ignitia. She was thirstless. So generally in acutes, calcarea is thirsty. So what happens here is, calcarea also I rule out. Nux is also thirsty, fine. But remember, Ignitia and Nux, they are very close. They're very close. Okay. So I'll take up in the differentiation, in the comparison, how to differentiate Ignitia from Naxwamica. We'll take it up so that will be a different section so that we can do justice to that topic there. So she did not have that anger like Naxwamica, or she did not have that sensitiveness to external things, like for example, light, sound, noise. That sensitivity was not there. We rule out Nux on that particular basis, and the remedy prescribed to her was Ignitia. Fine. Yeah, as Muktinder sir rightly says, that irritability, that anger was missing. Fine. She was more into a grief mode. She was more into a grief mode, and Ignitia was prescribed. And after Ignitia, she beautifully improves. Okay. Another case. This is again a case, a very nice case that gave me a lot of satisfaction as a homeopath. Please read this case and you come up with your own rubrics, and we will have a small interaction, and then we will conclude this case, how it was treated and what rubrics were selected. So again, a fresh case, 25/7/2020, and this lady had pain in chest for last 1 to 1.5 months, and she was complaining of pain in her throat. She told it is hurting. I don't know why it is hurting. I feel the pain. I feel pain in the pit of the throat. I went to a local doctor. He gave me medicines, and later he told me to do endoscopy, and the endoscopy reports were normal. Please understand the case step by step. Please understand the case step by step. Don't come to the conclusion immediately. Okay. So as you see, she had chest pain, she had pain in her throat, and then she went to a doctor and he prescribed medicines, absolutely no change. Then endoscopy was done. What happened? What is this? Then endoscopy was done. Okay. Then endoscopy was done. Endoscopy also comes normal. And then this doctor says, I am a gastroenterologist, endoscopy is fine. So hands up, you please consult a cardiologist. So she goes to a cardiologist who gets her echo, ECG. From his point of view, he looks at this patient as a cardiac patient and he gets all the things done. He says you have vitamin B12 deficiency and your LDL is slightly high, and he prescribes some medicines. She takes all those medicines and unfortunately there is no relief. Now, same question. What is that question? What is that question you need to ask? I'll just brief you about the case because I'm not typed it due to lack of time. So now what happened? One of my assistant had beautifully taken this case. Now, when did the problem start? How did the problem start? They are very, very important because any case which is of a shorter duration, always focus on the ailments from. That's very important. Unfortunately, in this case, what had happened, when my assistant was taking the case, her husband expired a few months back. Right? Her husband expired a few months back. Now, fine, her husband expired. Now, what happened? What happened? See, husband was suffering with a heart ailment. Okay. And she took him to a particular hospital. But many of our relatives, our friends told, please don't take him to that particular hospital. That's not a very good hospital. You take to some other hospital. But this lady, I don't know what happened. She insisted that he has to be taken to a specific hospital. And unfortunately, that gentleman, her husband, dies in the hospital. Now, after he dies, see, now she starts feeling very bad. Now, what does she feel? I should have listened to my relatives, my neighbors who told that hospital is not good. I did not listen to them and I made a mistake. I should have, if I had not taken my own decision, today my husband would have been alive. I made a mistake, is what her feeling was. Now, more than all this, my assistant who is listening to this presentation, he came running into my chamber and told, sir, this lady is weeping uncontrollably and I'm not able to manage. I'm not able to control. Her sister who had accompanied her, she also came. She also tried to console her. No, she was weeping loud and she was not getting consoled. Now, this is the picture that we had. Okay. Now, quickly, what are the rubrics that you think of here? Very good. Many of you have come with the right things. Yes. See, now somebody has given rubrics like delusion, what wrong she has done. See here, do you think it is delusion? I mean, whoever has told. See, here it is a fact. She has taken the husband to a hospital of her choice and unfortunately he expires. So I will not take a delusion here because it was a fact that happened and she starts blaming self. So two rubrics that from whatever you are told I've taken. One was reproaching himself. That was one. And ailments from death. Death of loved ones, you can take that. Now we are left with umbra, arsenic, ignitia, netremur. Now there was another very beautiful observation what my assistant shared with me, that she's been weeping. She's been weeping loud. Okay, now how do you convert this into a rubric? Now this is a beautiful observation. And the sister came, she tried to console, she was not at all fine. She told doctor, enough of your case taking, please let me go home, I'm not able to manage myself. Without my control, I'm weeping and I just want to go home. Please let me go home, is what she was trying to tell. Now, how do we convert this into a rubric? There's a pause. Hope I am audible, because when you don't, okay, very good. I am getting it now. Okay, see, there are a lot of things that's coming up here. Historical weeping, delirium weeping, sighing, good. See, sighing, I'll come to the sighing part a little later. Now, in the case that we are seeing here is why or what is the character of weeping that she has. Now, two things that we observe, and I was trying to tell you, each constitution, the way they weep is very, very important. Probably Muktinder sir has taken a class, a very interesting class. Even I could not attend that class, but my juniors, they were sharing their experiences from the class. You can just listen to that class, probably it's there on YouTube. Now, how each of them weep is also very, very important. Okay. So here, this lady was weeping. Now, this weeping loud was taken as weeping sobbing. Sobbing is when you weep loud. Okay. And weeping involuntarily was the other rubric that we took. See, now the remedies which were 5 becomes 2. Now we have Ignitia and we have Netremure. Now, how do you differentiate Ignitia? How do you differentiate Netremure? That again will take up under comparison. Okay, but now I'll also give you a small clinical clue here. Whenever you're stuck with such kind of a situation, yes, somebody rightly says you can look for thermals. Yeah, you can look for thermals. Ignitia is chilly, Netremure is hot. Now, another very important thing you have to remember here is this lady was sighing. This lady was sighing. That was one very good observation. And second direct question I ask whenever Ignitia comes up in an acute totality, I ask one question. And what is that one question I ask? When you become emotional, do you feel some kind of a constriction? Some kind of a constriction? Do you feel it in your throat? And you all know it could be globus hystericus or it could be anything. Ignitia has this characteristic thing that when they are emotional, okay, they feel some kind of a constriction. It is not the constriction that you have in lachesis. Okay, and you know why lachesis has constriction? It's because of the nerves. It's because of the nervous system which is sensitive. Fine, so they cannot wear anything tight. I'm not talking of that part here. I'm talking of some kind of a constriction, like somebody rightly said, it could be a globus hystericus, it could be like something getting stuck in the throat, or it could be that a tight feeling in the throat. When you have this, mind you, your remedy is right, and you can lock it on Ignitia. So this is what I had asked, and the lady confirmed, yes, I feel this. And you know, here she was given Ignitia CM. Ignitia CM. And important is also related to potency. Here Ignitia 30, Ignitia 200, even Ignitia 1M, I don't know how much good it will do. The kind of state she was into, I have the video, but I don't have the patient's permission. And it's not nice to share the video without her permission. So what I was trying to tell you is, like, you know, she was in a very hysterical state. She was sobbing, giving and all, and Ignitia CM was given. Now, important for you is the follow. This lady had some psychological symptoms. She also had a lot of physical symptoms. She was not able to sleep. She was not able to eat. There was a lot of sadness. She was missing her husband. Okay. We didn't do any counseling. She has lost her husband a few months back, and you know, many of them would have done counseling. Many of them would have told all good words. We are not bothered about that. A single dose of a right remedy was given, and she comes back after 15 days. And these are the words that the patient has told. Weeping is much better. Emotionally, I'm feeling more calm. See the beauty. Our remedies so beautifully they work, and you know that can calm down the mind. Meaning emotionally she's feeling better. She was definitely missing her husband because there was this Ganesha festival which happened, and every year both of them would go shop, bring Ganesha home. All those memories were there. But she told, "Sir, I am coming in terms with the fact my husband is no more, and I have got to live my life without him." And this is something, you know, marvelous thing that happens only when you give a right homeopathic remedy. Okay, so people also started noticing. See, you alone noticing is not important. People in our office, they have also started noticing that the smile is back on her face, and At least they're able to see her face, because otherwise she would weep involuntarily, and there was so much of sorrow in her face. No throat pain, and sleep is much better. After many days I have slept. See, the same night when Ignitia CM was given, that night onwards she had beautiful sleep. And sleep, a patient getting good sleep is very important sign of improvement. Okay. I'll share another case, small case. We have 20-30 minutes, and any doubts, you please keep it. I'll get back to you. So this was a very nice case. Now these two cases here, I have dedicated to that part of Ignitia, that emotional part of Ignitia, where they are attached to people, they lose people, and how they react when they lose people. They go into grief. Grief could be silent. We'll discuss it a little later. So those were two cases. Now another important aspect of Ignitia, you listen to this case and you tell me what your inputs are. Then we'll take up the third aspect of Ignitia. So we had this 16, 17 years old girl who came to us very recently, and she had severe pain and she had bleeding stools for last 2 days. Painful stools. Same question. What is that same question? What happened 2 days back? 2 days back, uncle, I got my results. Fine. Very good. So when you get results, good, you got your results. Fine. So what happened? Oh, good. You didn't get what you had expected. So, what was my question? You did not get the kind of marks that you had expected. You know what the answer she says? The girl, no, uncle, it's not like that. Actually, I was expecting 80% and I got 92%. You getting my point? So getting 92%, why should she develop all these things? I didn't expect so much. I was very happy. Fine. And this is the thing she tries to tell us. Now, what do you understand from this particular case? Where am I trying to take you next? Where am I trying to take you further? Here, what is it that I'm trying to, okay, there is excitement, very good. What is it? Yeah, there is excess joy. See, what I'm trying to tell you is, okay, elements from joy, elements from excitement, very good, agreed. But what I'm trying to tell you here is, yes, the Manjunath gets it right. I'm trying to tell you about something, and what is that? I am talking about that aspect of Ignitia where you see a lot of contradictory things. Meaning, happiness or joy should not cause pain, fissure in the rectum. There was no obvious reason. I inquired with her, sat with her, other than results. What happened? Nothing, uncle. And even this, I was worried that, I was expecting 80, not that I was worried, I was expecting 80, but then jackpot, I got 92. Okay. So the area that I'm trying to take you towards is the contradictory things that happens in Ignitia, which many of us are aware of. See, now another very important thing, stools, she has to strain a lot. Now, immediately my question was, I knew I had Ignitia in mind. And, I immediately asked her, what is the character of stools? She said, stools are soft. This was second contradictory symptom that we got in this particular case. So, as many of you told, I thought of coffea. Coffea was given and nothing happened. I took ailments from excessive joy, nothing happened. And then I had also given IGN as emergency, Ignitia, 1M as emergency. And next day evening, she calls back and says, uncle, I'm not all that better. Pain is there. I continue to bleed. Then I told you, take the emergency pack. And you get back to me after 2 days. And after Ignitia, the pain reduces, the bleeding stops, and she starts improving. So this is one contradictory thing I want you to understand in Ignitia. We'll talk of contradictory in next few slides. A young lady, an engineer, she presented to me last week. It was a case, very recent case, presented to me with pain in the throat. Mind you, whenever you have Ignitia, you will have this, they'll have pain, but when you examine, there will be nothing. Okay? So what this again tells you here is that it is more physiological, it is more functional. So patient complains of pain. And I ask the next question, when is it more? Sir, I am able to eat. Like, when I eat, I have no problems. But when I drink, I have problems. So whenever you have something like this, which is contradictory, okay, one remedy that should come and it should come is Ignitia. Okay. So see, when you look at this particular picture, throat pain, you'll also have two more remedies coming up here, belladonna and lacasis. You all know how a belladonna throat will be. It will be red, it will be in fever, especially in intermittent fever. See, during chill stage, many of us will not feel thirsty. When feeling thirsty during chill stage is PQRS, is something unusual. That's what you have in Ignitia. Similarly, during heat stage, generally you feel heat and you feel like drinking something, which I'm doing right now. It was a coincidence. I'm also drinking something now. But what you have to understand here is during heat, they don't feel thirst. Okay, and they don't feel like covering. Yeah, they don't feel like covering is still fine, but not feeling thirsty or feeling thirsty during chill is a contradictory symptom. Now, this is the example I gave you of a patient who, after biryani, felt better with his stomach upset. These are few contradictory symptoms you have in Ignitia. I hope the sensitivity, the bereavement, the contradictory things you have clearly understood. Now, from my practical experience, I'll just share few pointers so that it can be helpful or it will be helpful in your practice. Now, what are those things that I have observed when Dr. Varshini said I have 20 plus practical experience? What exactly that I have observed in Ignitia? See, now Ignitia, from what I have observed, acts beautifully in pseudosyphilitic cases. Okay, fine. In acute cases, I have seen wonders with Ignitia. When you have an emotional cause, or if you just see the second point that I've tried to sum up here is functional cases, when there is no underlying pathology. We have cases like, for example, DUBs, right? When you have no pathology, I mean, DUB itself says that, when you have no pathology, when you have no growth, you have bleeding. If the lady is constitutionally Ignitia, Ignitia works beautifully. I have failed in my practice. Adenomyosis, I have given Ignitia with no results. Okay, it because as I understand, the psychosis in Ignitia is very, very less. You don't see the psychosis. You don't see much of psychosis in Ignitia. So as I understand, pathology from my, I might be wrong. This is what I have observed. Seniors can correct me, but this is what I've seen. Or you might also start observing, in pathology, I have not seen good results with Ignitia. And for me, in acutes, if there is an emotion, constriction in throat should be there. Otherwise, I will not prescribe Ignitia. That is a rule in point. And again, sighing. See, these are all the observations that you should be very well versed with. Like, what is the patient doing? Taking that deep breath, and that gives a lot of relief, right? So Ignitia becomes more indicated, or your prescription becomes more confirmed when you are saying in Ignitia. Okay, and the last point, which is there in many of your material books, Ignitias have an aversion to fruits. Okay, so these are a few take-home points. It's all written in the books, but this is what I have confirmed, and I thought I'll just share it with you. Now we'll talk of a very important aspect. Now, what is that important aspect here is, you have two apples, and they both look similar. Only difference is the color. One is green, the other is red. Okay. So in this, okay, now I'll ask this question. Yes, comparison. Let me ask this question to you. What are the drugs that you want to compare Ignitia with? In the acute picture, what remedies? Very good. Would love to hear chronic picture of Ignitia. Fine. We'll take it up a little later. I'll be more than happy to share what I have learned from Vijaykrishna sir. I'll be very happy to share. Now, few remedies. Looking at the answers that you are trying to give me, or what exactly you want, it looks like you have already seen the PPT, because the same remedies, I have it here. Fine. The first remedy will be phosphoric acid. We'll talk of, okay, we'll talk of each remedy. We'll take up the comparison. We'll talk of each remedy in detail, meaning in comparison with Ignitia. See, phosphoric acid also has grief, ailments from grief. Phosphoric acid also has a silent grief like Ignitia. But what you also have to understand is, in phosphoric acid, you see more of indifference. In Ignitia, you see more of hysteria. Phosphoric acid might withdraw, and they can go more into an indifferent state. Not talking to people, taciturn, right? Now that is what you see in phosphoric acid. Both are chilly, both are thirstless, but phosphoric acid, though thirstless, because of the debility, they generally want something refreshing. Okay, they want a juice, or they want a fruit, which Ignitia does not like. Both are chilly, both are thirstless, both are conscientious, both have elements from grief, but not wanting to talk to people, more into dullness, more into weakness, I prefer phosphoric acid. Okay, so simple comparison, practical comparison, so that you remember this better. Naxwamika. I read in the chat box, yes, Naxwamika is again a remedy that we have to understand. Both belong to the same family, both have a same alkaloid. Nux is more male, and Naxwamika is more female. Sorry, Ignitia is more female. But what is it that you have in Naxwamika that you don't have in Ignitia? Ignitia is sensitive, mind you. Nux is not at all sensitive. Ignitia is worried about what people will think, but Nux will not bother. Ignitia, you'll have more of grief. Nux will have more of anger. Irritability, more of anger. Avota, fine? All those things you have it in Naxwamika, which is missing in Ignitia. Nux is, on the physical level, Nux is thirsty. Ignitia is thirstless. Nux is sensitive to all those light, that noise, sound, which you see missing in Ignitia. Right? Nux will have ineffectual urging for stools, which is missing in Ignitia. Right? Okay. Now Oramet. Oramet. Now Aurum is again a remedy which has a lot of honor. We have spoken in depth about Aurum. You can look into the YouTube videos. Beautiful, remedy, Oramet. See, Aurum will have more of esteem, more of honor. Aurum is more responsible. Aurum is more serious, right? And at least in acutes, Very rarely we think of orums. I have prescribed orum in few cases where, because of disappointment, they have gone to the extent of suicide, which you don't see in Ignitia. Right? And I always try to tell my students, when the thought of death comes, a serious thought of death comes, all these pseudosyphilitic remedies, like acute remedies, will not have a major role to play. You have to think of something big like aurum. Okay, again, a esteem remedy, a responsible remedy, a serious remedy, diligent remedy, aurum, natrum. Many good homeopaths remember natrum as the elder sister of Ignitia. Now, what is the beauty of natrum here is, in grief, if you want to compare Ignitia and natrum is more controlled. Okay, that's one word that will differentiate Ignitia from natrum. Natrum is more controlled. Natrum does not express, fine, and that's what I keep telling. When you have a natrum lady, you'll be shocked with the art of she retaining her tears. You'll be, if you can make a natrum weep, you are a very good homeopath. The art, the way how they control their tears, they're so emotional. You take them to that emotional attachar mode, you bring in all those old things, and you put her in that emotional mode. But the way she controls her tears falling down is a beauty. And I don't think any constitution has that capacity to retain tears the way natrum does. Okay. And if you are successful in the tears falling down, you are a beautiful homeopath. You are a very good homeopath. Okay. So natrums are more controlled. Natrums are more deep. Natrum is hot. Ignitia is chilly. Ignitia is thirstless. Natrum is thirsty. Fine. So these are few things, practical things. There could be many more things. I am trying to tell what I know. Carcinosin. Now, what is that is similar between Ignitia and Cars? Both are, constitutions which have good girl, good boy image. Both are diligent. Fine. Both are artistic. Fine. Now, both are sensitive to reprimand. These are the common things. Now, what is that is uncommon between Ignitia and carcinosin? Carcinosin is very yielding. Carcinosin, like Ignitia, wants that love. They're dominated by parents. Fine. So they always want approval. They always want to win over the parents, and they can go to any extent. Right? They're very yielding. And that they also miss love like Ignitia. But Ignitia, when they miss love, they can throw tantrums. They can throw convulsions. They can throw. That's what I am trying to tell you. When compared to other remedies, that that control over the emotions is missing in Ignitia. Fine. That's how they become hysterical. That's how they throw jerks. They throw convulsions. But cars is a remedy which can hold back. Okay, there's a lot of dignity in cars, which could be missing in the other remedies. Now, lacases, emotionally we can't compare Ignitia with lacases. They are poles apart. Okay, thermally hot, thirsty, and lacases probably we were talking about lacases here because of the throat. And I told you, in lacases, the constriction is more external. The constriction is more because of the sensitivity of the nerves. In Ignitia, I told you it's more internal. They feel that globus is because something getting stuck, which is not there in lacases. Pulse, yes, pulse comes very close. Many of us give pulsatilla to Ignitia because they both are very moody. They both are moody. Fine. They both are emotionally vulnerable. Fine. They both can break down. But what is the difference between Ignitia and pulsatilla? Simple things to start with. Pulse is hot. Pulse is thirstless. Very good. Somebody has rightly said. Ignitia is thirstless. Ignitia is chilly. consolation ameliorates in pulsatilla. See, my wife had a case, she was sharing it with me the other day. One of her patients, no, she would talk about her problems, call other people, all her distant relatives, and she would call them and she would tell, see, this is the problem I'm suffering with. You're getting my point? Meaning she wanted that kind of a consolation from them. She wanted them to listen, fine. She wanted them to console, okay, you'll be fine, stuff like that, which is not there in Ignitia. Ignitia does not like consolation, fine. Pulsatilla likes more of consolation. Now, a beautiful remedy which many of you have in your mind is Staphysagria. So in the next slide, I'll try to dedicate a few points and I'll try to differentiate between Staph and Ignitia. Now, before we take up the differentiating points, what is common between Staphysagria and Ignitia? Yes, what is common between Staph and Ignitia? Can somebody quickly tell me what is common so that we have some interaction? I know it's 10:20. Many should be in a sleepy mode, but yes, what is it that is common? Yeah, both are sensitive, very good. See, both are sensitive, both are diligent remedies, both have this good girl image. Then how do you differentiate Ignitia from Staphysagria? How do you differentiate Ignitia from Staphysagria? Now, I have gone step by step. When hurt, how will Staphysagria react? When hurt, how will Staphysagria react? Staphysagria will go into a grief mode. Okay? Sorry, this should come, I mean, we need to exchange this. I'm sorry, I'm not checking if you're sleepy or not. I mean, this is a mistake which has happened, unintentionally. What I was trying to tell you is, these things will go when you're taking a pick piece, be careful, you correct this. When somebody is hurt, if he is Staph, the reaction is anger. And Staph is a very dignified person and they suppress anger. If it is Ignitia, then they go into grief. So please interchange this particular thing. Now, when losing position, you all know, for example, many times the child would have gone to school, and when the child left to school, she or he was absolutely fine. And when the child comes back with high fever. And what has happened in school? They have given marks. And Staphysagria, Ignitia, for both of them, position is very important. Now, quickly, how do you differentiate Staph from Ignitia related to this particular point? How do we differentiate? See, in Staphysagria, the position will add to prestige. The position will add to dignity. Fine? In Ignitia, the position will add to the approval. They're worried how the parents will react. If I don't get first rank, if I don't get out of out, what will my mother do? Will my mother not hug me? Will my mother not kiss me? So that emotional insecurity, that emotional vulnerability is what affects in Ignitia. But in Staph, it is more of that, that I should come first. They are not worried about that emotional part, but they're worried about that nobody can take my position. It's my position. Fine? So that is the simple difference. Keeping this in your mind, if you look at the need, Staphysagria has more of esteem. Though Ignitia also has good amount of esteem, but love is what Ignitia needs more than Staphysagria. And what are they sensitive to? Staph is sensitive to criticism, rudeness, reprimand. And Ignitia, generally, they're sensitive to reprimand. Okay? And a few more points. When you look at the miasm, Staph is more psychosyphilitic and Ignitia is more sorosyphilitic. These all things have a lot of value. I hope you understand the value of all these things. And before and during fever, Staph will have a lot of hunger and Ignitia will have hunger after fever. Somebody wanted the previous slide. Okay, this is a slide. Who wants to take a pic and take it, but please make sure this is changed. Hope you have taken the pic. Yes, so the miasmatic thing, and this is what I wanted to highlight here. Now, Now, the entire exercise of me telling you about Ignitia acute picture is where will you apply the acute picture of each remedy? So this is the application part, the utility part. See, acute pictures, as you know, can be used in the psoriatic cases, it can be used in pseudosyphilitic cases, and it can be used in autoimmune cases. And you cannot enter through the acutes mainly in psychotic, syphilitic, or genetic mutation cases. This is a very important slide. So if at all there are any doubts, we'll take it up in the questionnaire session. This is what I wanted to highlight, very important. Now, I don't know if I can tell this. The YouTube thing, I have started with a YouTube channel. Many of you were asking. So, interested people can subscribe so that many more such things can be put up in the YouTube channel. So details will be shared a little later. Now, before I take up the questionnaire session, which will definitely do it, I would like to thank you. Now, before I thank, I hope the effort and the exercise of today's webinar was fruitful. Okay. So, see now, many questions might come up related to this slide. I will deliberately avoid the questions related to this particular slide because if you attend Vijaykrishna's classes, you'll have more clarity. So me explaining this slide will be a little difficult, but anyway, I'll try my best. So I would like to thank few of them, my principal sir and my teacher, Guru Prasad sir. And this gentleman, many of you know, is doing a great job, great service to the humanity, encouraging, teaching, sharing his priceless knowledge with all of us, Muktinda sir. So thank you so much. And personally, I would like to thank you because this webinar happened in a very short period. And sir gave me the platform to present this. And thank you, sir, for the platform. And this man again, you know, and Dr. Manohar, my very good friend and the founder of Homeo Guide, who is the co-sponsorer of today's webinar. Thank you, boss. He's been always there. My thick and thin has been there. And one young gentleman, many of you are familiar with this face, Dr. Harsha. Again, see now this webinar happened in a very short period. And a lot of people I would like to thank. Fine. And special thanks to Dr. Harsha. And see, I was always trying to tell you about my assistant doctors, my team. So very dedicated team. We should be lucky to have a team of young doctors who have been doing a great job in my clinic, and I would definitely thank all of them. Without them, the seminar would have been not possible. Okay, a big thank you to all of you for joining. And I know it's late, and on dot 10:30, I thought I should finish, and I'm trying my best to finish. Thank you all for joining. And we have many senior homeopaths, predictive homeopaths. They're all part of today's webinar. So thank you all for joining in. And my mail ID, my contact number, if at all you have anything, you can please feel free to share and get back to me. And one last time before we take up the questionnaire session. So there's also a very nice webinar coming up tomorrow. So doctors who are passionate about homeopathy, please do attend this webinar by Muktinda sir. If I'm right, yeah, time is given there. This is tomorrow at 5 p.m. So do join. Okay. Now, before I close